Sleep Disorders and Insomnia in College Students by Chip, Carol, and Ashley.
I'm Ashley, and I will be talking about what are sleeping disorders, what are some types of sleeping disorders, and the effects of sleeping disorders on college
Hi
students.
everyone, my name is Chip, and I will be talking about what causes sleeping disorders in college students, and I will also be talking about the common symptoms of sleeping disorders.
I'm Carol, and I'll be talking about the statistics of sleep disorders in college students and the treatment and prevention of sleep disorders.
So, what are sleeping disorders? Sleeping disorders can also be referred to as sleep wake disorders, and they involve problems with the timing, quality, and the amount of sleep that an individual gets. According to the American Psychiatry Association, sleeping disorders are often linked to both physical and emotional problems as they can contribute to or worsen mental health conditions. So, what are some types of sleeping disorders? The most common of the sleeping disorders is known as insomnia. Insomnia involves trouble with falling asleep or with staying asleep. Sleep apnea is another disorder, and it involves obstruction to breathing while sleeping, which causes periods of wakefulness, which interrupt sleep. Non-rapid eye movement sleep arousal disorder involves episodes of incomplete awaking from sleep, usually accompanied by sleepwalking or sleep terrors. Hypersomnolence disorder is marked by excessive sleepiness, even when getting at least 7 hours of sleep. And the last on this slide is narcolepsy, which involves periods of an irrepressible need to sleep multiple times within the same day. So, what are some effects of sleeping disorders on college students? The general effects of sleeping disorders include fatigue or decreased energy, irritability, affected executive functioning, which impedes decision making and problem solving, trouble focusing, and exacerbation of depression or anxiety symptoms. These effects can and will also seep their way into affecting the academic portion of a college student's life. In a study by Buboltz and colleagues, it was found that sleep duration and sleep schedules are significantly correlated with a student's GPA. As sleep duration decreases, GPA decreases as well. And as sleep schedules become more irregular, GPA decreases. When a student gets poor sleep, they have a reduced daytime functioning, which can inhibit their ability to perform well on their academic tasks. In a study published in the Neuropsychiatric Disease and Treatment Journal, it was found that sleeping problems are correlated with impeded learning, resulting in reduced academic success. In the same study, it was also found that students are more at risk of experiencing mental health issues if they are suffering from a sleeping disorder.
Some background information about sleeping disorders. You may ask yourself the question, what even causes them? Sleeping disorders are extremely common among Americans and college students. There is very little research conducted asking the question why people even suffer from them. Now, there are factors that can contribute to a sleeping disorder, which one of them being family history or your genetics, your genes. Sleeping traits, which includes insomnia, seem to run in some families and can be a cause for some sleeping disorders. Another factor is your physical health. Some may suffer from asthma, which can cause snoring or in some people sleep apnea. And mental health also plays a major role in sleeping disorders. About half the people with chronic insomnia have at least one mental health condition like anxiety or depression. And, of course, life. Life happens. We deal with all kinds of stress or difficulties in life that can sometimes keep you up at night or even affect your quality of sleep. And another factor is your habits and your routine. If you take naps during the day, or you have an inconsistent bedtime schedule, or you may be even drinking a couple coffees or even a Red Bull if you're into that, that can also disrupt your sleep cycle and keep you awake. But now you may be asking yourself, what are the symptoms? How do I know if I have a sleeping disorder myself? One of those symptoms is struggling to stay awake during the day. Some may even struggle to drive because they begin to doze behind the wheel. Another symptom is a slower response time. You may find yourself not reacting as quickly if there is traffic or even a sudden red light. Having difficulty concentrating is also another symptom of a sleeping disorder. You may feel groggy or tired and may have trouble recalling what had happened beforehand. And finally, we also have a symptom that most of us like to do: napping. I love napping. I'm sure you love napping too. But it becomes trouble when it becomes a common occurrence, maybe even every day. And that could be a sign of a sleeping disorder.
So, some statistics about college students and sleep disorders. According to a study done by the CDC, at least 60% of college students have poor sleep quality, and there is a 26.4 prevalence of insomnia among college students. There's also correlation between mental health and sleep. For example, it was found that students who have depression are 9.54 times higher to experience insomnia, and it has been found that around 7.7 of college students meet all of the criteria for insomnia. And this chart shows statistics relating age to frequency of insomnia, and ages 8 to 24, which college students would fall in, show the highest percent experiencing insomnia every night. Treatment and prevention of sleep disorders. So, in order to get better sleep, there are habits college students can implement into their lives. College students should establish and maintain a consistent sleep schedule, limit caffeine and alcohol intake near bedtime, avoid screen time before bed, do some sort of physical activity during the day, and find effective ways to relax and wind down. Cognitive behavioral therapy is also an option for insomnia. This type of therapy usually is the first thing recommended to those with insomnia and uses strategies such as light therapy, relaxation techniques, and sleep restriction. Light therapy helps people adjust the circadian rhythm in order to maintain a good sleep schedule that isn't too early or too late. Relaxation techniques include breathing exercises and progressive muscle relaxation. These strategies help to reduce anxiety and tension in the body, allowing for better sleep. Sleep restriction means to restrict sleep during the day as to not shift the circadian rhythm and disturb a consistent sleep schedule. If insomnia is still not able to be treated those ways, there's the option of prescription and over the counter medication. To conclude, sleep problems and disorders are common issues for college students, and they should be educated and aware about the treatment and prevention.